the Tylock Eye Care and Laser Center in Irving, and I want to introduce you to Dr. Gary Tylock. He is going to be performing the surgery this morning on Lisa Harris to correct her vision. Thanks for, well, I don't want to shake your hand. You're in your gloves already. Thanks for letting us come and observe this.
Glad to have you.
This is a first for us, I know, to do surgery on Good Morning Texas, and a first for you to have this done live as well.
Right.
Let's talk first about who is a candidate for LASIK surgery.
LASIK will correct nearsightedness, farsightedness, as well as astigmatism. It's an excellent procedure for correcting nearsightedness, farsightedness, and astigmatism.
Does it hurt?
People that have been dependent on glasses most of their life.
Okay.
Typically, the procedure is painless. If there is any discomfort, it's very, very short-lived, if at all.
I mean, this is just this will only take a few minutes, right?
Right, just a few minutes.
Wow,
right.
And will Lisa be awake?
Yes, yes. Her eye will be totally numb, but she'll be very awake for the procedure.
Wow. Did you give her anything?
We gave her just a little bit of Valium.
Oh, okay.
Just a little bit.
Now, tell me about the success rate, though. I mean, is everything going to be 20/20 when you're done with Lisa?
She's going to do extremely well. I would anticipate her vision being 20/20, 20/25 range. With any surgery, there's always going to be a little bit of range of accuracy. But if people are prepared well for the surgery and they understand the process, virtually everybody's extremely happy with it. With any kind of surgery, there is always a risk. There is always some kind of risk. But these procedures have been refined and improved over the years, and LASIK is extremely successul with a very quick recovery rate.
You know, I hear a lot about people experiencing glare from headlights in the evening after they get this done. Is there a chance that could happen to Lisa, or is that common?
Yeah. With this procedure, initially in the first month, there may be some halos around lights, but typically that's minimal, and that diminishes after about 4 to 6 weeks. And again, later at about 6 months, it almost drops off to nothing in most instances. Patients that have extremely high powers, though, extremely high powers, will tend to notice that more.
Okay.
And also, depending on the size of the pupil, that can have a bearing in that as well, in dim light, the size of the pupil in dim light.
Let's say hi to Lisa, who I know is probably very relaxed right now. Lisa, what do you do for a living?
I actually work for Lifestyle Development Group in Bedford, selling condominiums, real estate sales.
So you do a lot of driving?
Yes.
And hopefully a lot of paperwork.
Absolutely.
and right now you're nearsighted, is that right?
Yeah, nearsighted, absolutely.
Okay. Are you nervous?
Not too much, a little anxious, but mostly just very excited.
Yeah, what made you decide to do this morning?
Well, you know, I was always the kid growing up with the squinted eyes at the chalkboard, and I'm ready just to be finished with that, really.
Just want to throw those glasses away.
Yes.
And you and I both know squinting causes fine lines and wrinkles.
Yes. Don't want any of that.
All right, well, I think in just a few moments we are going to begin surgery. So we're all getting prepped here in the surgery center. And when we come back, oh, see, I get to wear a cap. This is so exciting. This is like ER. When we come back this morning, we're going to actually show you what Dr. Tylock is going to do on Lisa. So he's going to get an eye started, and then later in the show, we're going to do the other eye. So you're going to see this from start to finish. It'll be very educational for you if you're thinking about getting this done. And we just appreciate Lisa being our guinea pig patient this morning. Back to you guys in the studio.
Definitely, LASIK, that's the hot buzz. Everybody wants to know about it, so we look forward to it. We'll check in with you later.
Isn't it amazing that we can watch that live on TV? That's kind of neat.
There's so many things you can watch live on TV now.
I know. I need to get that done, but I'm scared.
Well, let's watch it, and maybe that'll, squash some of your fears. We'll see.